This is Your Anxiety Toolkit, episode number 96. Welcome to Your Anxiety Toolkit. I'm your host, Kimberly Quinlan. This podcast is fueled by three main goals. The first goal is to provide you with some extra tools to help you manage your anxiety. Second goal, to inspire you. Anxiety doesn't get to decide how you live your life. And number three, and I leave the best for last, is to provide you with one big, fat virtual hug. Because experiencing anxiety ain't easy. If that sounds good to you, let's go. Well, welcome back, CBT School family and Your Anxiety Toolkit listeners. I am so thrilled to have you here with me. Quickly, before we move into this incredible interview, I wanted to quickly remind you guys that the OCD Construct online conference will be tomorrow. If you're listening to this on the release date, please go to ocdconstruct.com to sign up. It is a free virtual conference. I will be speaking about exposure and response prevention, which is one of my favorite topics. And so if you happen to get this in time, please do go and sign up. I am sure you will get a ton from it, and it is free. Second of all, let's go straight into the I Did a Hard Thing segment. Today we have a contribution by an amazing CBT school member. Her name is Heather, and she said this. I had posted, "Guys, tell me about the hard things you're doing." And she responded by saying, "I lived life. Sometimes that is the hardest thing of all to do for me because everything feels quote unquote not right sometimes." You know, and this is so true for everybody, I think. But I lived while still experiencing intrusive thoughts. I saw a screech owl that I fell in love with, and I visited a friend I had isolated myself from. Doing all the hard things, or at least I'm trying. Even writing this is a hard thing. Now, I just loved this because this is the work. This is it. It doesn't have to be perfect. It's just about living and being present and then taking notice of what else is happening, right? So while you're anxious and you're living your life, you might find a screech owl, right? How cool is that? Or you might even find that you can reconnect with someone that you had isolated from. So this is so inspiring. Thank you, Heather, for sharing that. And I agree. Doing the hard things, or at least trying. That's awesome. That's all we can ask for. You don't have to be perfect at it. You don't have to be doing the hardest of hard things. Just one thing at a time. It's brilliant and it's beautiful. Okay, so let's go on to this week's episode. Really, you guys, this is a really cool episode. I interviewed a clinician and a researcher. His name is Jed Siev. And he is the assistant professor in the psychology department at Swarthmore College. And he is brilliant. I learned so much from him today in this interview. It was really, really cool. Now, the topic of today's podcast is around religion and spirituality and morals and how they can get hijacked, you could say, by anxiety or uncertainty. We talk about religious obsessions and moral obsessions. We talk about how we can still hold ourselves within our faith in a very beautiful, loving, and faithful and trusting way without letting anxiety trump it or take over. And like I said, I treat a lot of these fears and anxiety and obsessions in my office. But, you know, Jed had this really beautiful way of holding sacred people's religious and moral views and being very, very strategic in how he treats it clinically. And like I said, I learned a ton. So this, I'm sure, whether you have this specific obsession or not, I think you'll really, really benefit by listening, because some of the stuff here is so in line with the values work that we've done in the past on past episodes, and learning how to not let fear take away the things that we love. So I'm just going to leave it at that and go straight into the episode. I hope you enjoy it, and I will talk to you very, very soon. Welcome. I am so thrilled to have Jed Siev with us today, and we are going to talk specifically about scrupulosity and moral obsessions related to obsessive compulsive disorder. Now, the reason that we are doing this is because so many people requested to have an episode on this, and Jed, who I'm so excited to have, came highly recommended for this specific topic. So welcome, Jed.
Thank you so much for having me.
I'm thrilled to talk with you. So we have already sort of prepped together some questions that we wanted to make sure we address. So I'm just going to get straight to the questions. What is it that brought you to the field of treating obsessive compulsive disorder?
Dumb luck is the answer. I went to grad school wanting to study pediatric anxiety. And if I'm going to be honest, I didn't really understand OCD real well. Well enough to answer the right questions on tests. But it was weird. It's this, strange, magical thinking and doing bizarre behaviors. And it seems so delusional and ridiculous if you don't understand it. And I really wasn't particularly interested in it. And but as luck had it, I came to the University of Pennsylvania in Philly. There are all these great OCD resources and research and clinicians. And my first treatment practicum in grad school, by at least half chance, maybe more, was with John Grayson. And so then once I started to really work with folks who have OCD and understand it, kind of the internal logic of it, and I just got really fascinated and taken with it. And of course, we can help people so much with our behavioral treatments, and that's really rewarding as well. So I fell into it by accident and then fell in love with it.
Yeah, I feel like that resonates so much with my story as well. It was total accident, but just the best accident that could have happened career-wise. So I totally get that. Awesome. And how cool. You had Jonathan Grayson as your mentor. That was very lucky.
Yeah, I was really fortunate. Got to work with a lot of great folks in the OCD world, and didn't deserve it, didn't intend to set it up that way, but it fell into my lap, and I'm not going to complain.
Right. Well, it sounds like you're doing some amazing work, and I'm so excited to talk with you about this particular area of OCD. So let's just go straight to it. So tell us a little bit about what is scrupulosity and, what your thoughts are about that.
Yeah, well, scrupulosity, the way I usually define it is pretty broad. It's when core obsessional fears in OCD latch on to something either religious or moral. And that's pretty broad, though, and it actually becomes a little tricky to define. So the way I actually like to think about scrupulosity is it's more of like a category of core fear than it is a subtype. And what I mean by that is people can have scrupulosity that looks, sort of topographically or something. It looks like just about any other type of OCD. You can have a scrupulosity that really is all about contamination, but it's about ritual contamination and whether it has to do with like menstrual purity laws or keeping kosher and cleaning oneself properly before prayer, those kinds of things. And one can have scrupulosity with sexual obsessions where, every time you go to church, you get intrusive thoughts of doing sexual things with Jesus or something like that. And maybe that's blasphemous. And so really, you can be scrupulous in any of the typical sort of symptom dimensions or subtypes. On the other hand, even though scrupulosity doesn't have to be religious, we might think of it as, again, a core fear related to morality. But it does get messy at the boundaries to define it. For example, I would say every culture, at least that I know about, has a problem with murder, let's say, certain other things like that. But somebody who has violent obsessions, we don't necessarily think of them as automatically being scrupulous, even if their obsessions have a fear that is something that's immoral. So to me, that boundary becomes an issue of is the fear mostly driven by a fear of I'd be evil, I am evil, bad, immoral, or something religious, or is it really not quite about that?
Right. So it's so important. And does the differentiation change related to how you approach it, or would you approach them all the same way?
You know, we were talking about this a little before off air, so to speak. In some ways, you have to pay such careful attention to the content to really understand the core fears and design the best exposures. And in some ways, you really don't want to pay much attention at all to the content because it doesn't matter. There's nothing weirder about obsessions about going to hell versus obsessions about losing control and stabbing your kids versus obsessions about accidentally not checking that the stove is off and people dying from a gas leak versus contaminate. It's really, it doesn't matter. So if you can step away from the details a level or two of abstraction and just think conceptually, then no, it's not really different at all.
Right.
Although some of the modifications that you need to make to help people meet their goals in an effective way that's still consistent with their values and their belief system, those can be specific.
Right. Right. Yeah. And I think that's such an important differentiation to make in terms of a lot of the time with my clients, they will declare that we do have to be very careful, and compared to someone, let's say, with contamination, just like simple contamination, because this involves my religion and maybe my afterlife or something like that. And so I think that just the content, the specific topic in and of itself might appear to feel more scary. Do you agree?
Yeah, the stakes seem very high when you're talking about, God, eternity, and those kinds of things, even higher than the stakes seem about stuff like sickness and death and
Right.
other kinds of things you might be responsible for.
Right.
So I can understand why people do feel that way. At the same time, you probably had this experience too. A lot of people get sort of lured into a grass is greener way of looking at it. If only I had that type of OCD. And I hear that from people I work with on both sides. I hear people who are stuck with such severe contamination symptoms that really just they can't go places and they just wish it was just all in their head and with thoughts and sort of obsessing in that way. And then, of course, the other folks wish it was just so easy enough to do exposures where they could handle things.
Right.
So it's true, but it's also maybe not always true.
Right. So true. So I know you've sort of answered this question, but how does moral obsession differ from scrupulosity in your opinion?
Yeah, so I think that might be just like a semantic issue. I don't use those differently.
Mm.
I don't know. Maybe some people say moral obsessions when they mean not religious scrupulosity. I just call that secular moral scrupulosity. I think we're talking about the same thing, but maybe sometimes people mean something else.
Right. And so play it out. You've already given so many incredible examples. What might be some other examples of obsessions that come up in this area? And then some compulsions that might be done around those
Yeah.
obsessions.
Okay. Well, I'm going to paint with really broad strokes here. So with that caveat up front, certainly there are lots of exceptions to what I'm about to say, but you can see sort of themes that vary by religious group sometimes. For example, Christians, especially Protestant Christians, with scrupulosity, do a lot of obsessing about accidental or inadvertent devil or Satan worship, going to hell, offending God, blasphemy. My colleague Ted Witzig also talks about how for many of the people he works with, there are kind of two versions of that. There's one that's a little more of the intrusive thought where you're thinking things that are really unpleasant to you to think about. And then there's a more ruminative type. Do I really love God enough? Do I really prioritize this? So a little more ruminative. That I think those are really common with Christians. Catholics have a similar manifestation, but there's some more specific rituals that it can latch onto. So you end up having a lot of Catholic folks with scrupulosity who overuse or misuse confession. Maybe they won't take communion because they're worried they're not in a pure enough state, or maybe they're worried that they might drop the host somehow. So there's some slight fears about committing the unpardonable sin, which is such fertile ground for OCD obsessions because it's really unclear what would count. And with Jews, where there's so many behavioral sort of restrictions and obligations, I often see it latching onto those very specific things. So I've seen lots of Orthodox Jews with scrupulosity where it's basically contamination OCD, but it's contamination about something like I can't make my toddler a bottle and cook meat on the same day because what if there's residue from the dairy and the meat and you're not supposed to cross-contaminate them, accidentally making vows, prayer, having the right intention during prayer, articulating the words exactly so. And then you've got secular moral scrupulosity, which might be stuff like somebody told me recently that she obsesses about when she hears or sees something bad in the news, which is, of course, all the time. Did I really feel enough empathy? Did that really hit home enough? And trying to check that and look for other things to try to gauge if she's really feeling it enough, with the core fear being, if not, I'd be fundamentally callous or evil or that kind of stuff. So it differs quite a bit in the manifestation. And of course, I only just said a couple of religions.
Right.
So every religion can have their variation on those things.
Right. And I think that's so interesting to say, because I think, we always talk about like OCD attacks whatever you value. And so common things I've seen is like, if you really value being honest, you can kind of become compulsive about being honest about everything. And you're immoral if you don't, or that you've never cheated. So then you go back and sort of assess what you did as a 6-year-old and whether that was cheating or not, because did I look at my friend's test or not? So it really does really attack whatever the person values and specific to them.
Yeah, exactly. That's the way we think about it too.
Right. Okay, wonderful. So I read a bunch of your articles, which I think are fabulous. And I think that we should, what I'll do is I'll link to any resources that you feel are really helpful in the show notes. I think that would be so helpful for people who are struggling in this area. But you said a quote, which I thought was, pretty brilliant, or brilliant, all brilliant, which was this. It says, clearly OCD, not religion, is the problem. And the goal of treatment is to not take a religion away from the patient, but to give it back. So can you talk more about this?
Yeah, sure. Well, for a while, researchers thought that religion would be some sort of risk factor for OCD. And in a sense, that sounds maybe offensive to some people, but it's also a little bit understandable, because there are things that in OCD land, we sort of think about as being obsessional or leading to that sort of thing, that are pretty normative in some religions. So one obvious example of that is just whether thoughts can be important, whether thoughts can be sinful. So that's something that differs quite a bit by religion, but certainly Christians believe that you can sin in thought. And that's a normative part of doctrine. There are passages in Matthew that say it explicitly. And actually, because of that, I've found in some of my research that it's not a good indication, just because somebody endorses those kind of beliefs, that they have OCD symptoms if they're Christian. In Judaism, that's not emphasized, and it's a better indication of pathology, actually, for Jews, if they're thinking that way, because it's not a regular way to think. But people started to try to test. They were looking to see if this was going to predict higher rates of OCD, greater symptom severity, this meaning religion. And if you look through that literature, there's just next to nothing. There are a couple of findings that there's slight elevations, but they're still way subclinical. Bottom line is, research has been very clear that religion is not a risk factor for OCD. Prevalence rates aren't higher. There's no real correlation in most studies. It obviously works for most people. Think about Catholicism, Judaism, the world's major religions have been around for a really long time, and most people don't have this problem with them. And in fact, on top of that, in one study, we found that 70% of our scrupulous sample said that their symptoms were interfering with their relationship with God or their religious observance. So religion's not causing OCD, and OCD is interfering with religion. There are people who leave their religions not because they want to, sort of for theological reasons, but because it feels too oppressive to them. They can't take it with the OCD anymore. There are people whose religion, they're contorted with fear and dread because of their obsessions. And so what we want to help people do is figure out what they value in life. It's kind of consistent, I suppose, with an ACT way of thinking about it. What matters to you, what's important to you, what you value, and learn to be able to live that instead of a life where you're pursuing anxiety reduction. You're not really worshiping God, you're worshiping your OCD, as it were.
Right.
And so we think that it's also a great way. That's not necessarily the reason. The reason to do it, I think, is because it's true, what I just said. But a really nice benefit of that is it's a great way to align with your patient. You don't even have to share their beliefs. But your goal is not to make them like you. I think some people are worried, these academic psychologists, so many are atheists. They're going to just try to make us get rid of our religion. They think the religion is the problem. The religion is not the problem. at all. The religion is being impacted negatively by the OCD. Let's cut out the OCD and you can live the life that's fulfilling for you.
Right. It's so powerful. And I think very hopeful when you say it like that, because I think by the time I see people, by the time they've figured out what it is and got a diagnosis and they're to see me, they're exhausted. And it might seem like the only solution is to leave the religion.
That's right. It's a real shame because they often are caught it's even a little bit worse than what you and I had said. They feel sort of trapped between the two because some people have had experiences where therapists have just said, look, like either you're sick and therefore it's okay to break these religious rules, or religion is the problem, and push them to abandon it. And on the other side, they sometimes have gotten the message from some of their religious authorities, rigidly in the opposite direction. They're really trapped. Between feeling like they have to choose to live with this OCD and all of the things it's doing to them, but their religion, or abandon all of it to get rid of the OCD. And it's really a shame because you don't have to.
Right. I love it. I'm so grateful that you have, I saw that and I love that you wrote that, because I think that is probably sums it up all in one beautiful sentence. So thank you for that.
Thank you.
What does treatment look like for scrupulosity and moral obsessions?
So in many ways, it's fundamentally the same as typical treatment, which for me means ERP. I always default to exposure and response prevention, certainly supplement with some extra cognitive work, maybe especially with Scrup in certain ways. But fundamentally, we're trying to help people get to the same place, mostly via the same means. But there's some modifications and adaptations that make that go more smoothly. And I think a lot of folks listening either have been on the sort of therapist side struggling to help somebody with this, or they themselves have been struggling to try to find out how to do that. So some of the modifications have to do with just upfront conceptualization and assessment. And it's really hard, for example, to distinguish religious rituals from OCD rituals if you're not familiar. The example that I often use, that I got from the person who first kind of taught me about scrupulosity, is if I told you somebody wakes up in the morning and they won't touch their eyes, nose, mouth, ears, or anybody else until they've gone and washed their hands, and it has to be in a specific order where it's 3 times over each hand, starting with the right hand, alternating. Is that OCD or is that religion? I'd say most people would have no idea. How would you tell? It certainly sounds like it could be OCD. In that case, that's a regular religious ritual, actually, for many Orthodox Jews. And so disentangling the OCD from the religion is a big part of it. Figuring out how you recognize where the problem is, what the problem is. It turns out actually religious people are better than people who are not in that same religion at recognizing OCD of that religious type. I know that's a weird way to say it, a little bit awkward, because they know what's normal. They know what's excessive. They know what seems off. So it can be done. I think that another issue has to do with attitude, framing, maybe the therapeutic stance. And that includes sort of emphasizing what I told you before, which is that religion is not the problem. And our goal is not to try to cut that out. To the contrary, it's to disentangle the OCD from the religion and cut out the OCD. And in fact, it's sort of similar to if somebody had obsessions that they might be a pedophile. It's pretty obvious, I think, to most of us. It wouldn't make sense to conceptualize that as struggles with sexual orientation. Some people do struggle with issues related to sexual orientation, but that's not what pedophilia OCD is. It's the same thing here. It's not a religious issue. It's not because you're religious, and it's not even fundamentally a religious issue. And as you mentioned, OCD gloms on to whatever's important to you. One of the big tricky areas, I think, is in figuring out then how to violate OCD rules without violating religious rules. And I've heard really otherwise expert therapists and researchers advocate for just violate the religion. Like the person, we all know, if you're listening to this, you probably know well that OCD can really interfere with your life, and, take care of yourself and don't worry about that sort of advice. And so just for example, if somebody has OCD about that example I gave you before, making a milk bottle, cooking meat, what if I accidentally cross-contaminate dairy and meat? I've heard people suggest, well, they should just go eat a cheeseburger. Yeah, it's against the rule, but they're sick. They need to get over it. I really think that that's bad advice for a few reasons. I'm using that just to sort of illustrate what would be the right way to do it. In a sense, it's any dispensation you get because you have OCD To me, I worry that's a little bit compulsive. That's like reassurance. That's saying it's okay. You're off the hook. Then where's the exercise in practicing tolerating the risk and the uncertainty? And the other thing is, why do we want to communicate to people that just because they have OCD, they're somehow less than everybody in their community? I don't want my patients to feel like, they need accommodations to be whatever religion they are. I want them to feel like they can learn to live the life that matters to them like other people do.
Right.
And so sort of breaking rules with OCD as the excuse, I don't think is great. And I guess maybe a good analogy to try to crystallize that is if you had somebody who told you that they were obsessing about accidentally getting pricked by a dirty needle in the street. And so let's say versions of avoidance and rituals might be like they would never wear sandals outside in the summer, let alone walk barefoot. And because what if there's a needle in the ground and I step on it? So how would you handle that? Would you say, all right, well, listen, you got to practice the uncertainty. So let's go find some dirty needles and we'll stick ourselves with them. That's insane. What do you mean? That's the fear. That's not the normal behavior for other people that the person is struggling to do. What would you do? You'd wear sandals. You might even walk around barefoot. So maybe a drop further than many people do, but people do that too. And you'd be tolerating the risk of maybe getting pricked by this dirty needle, but you wouldn't be doing it on purpose. It would be an acceptable risk of the sort that other people make in this area. So I think that is a great analogy when you're thinking about how you would do religious kind of exposures as well. It wouldn't make sense to eat the cheeseburger. That's analogous to just sticking yourself with a needle. That's the fear. That's clearly prohibited if you keep kosher.
Right.
So don't do it. But all of the excessive things that you're doing that other people are not doing, and ways that you might even overcorrect a little by pushing the limit, but within the bounds of what's okay. So maybe in a lot of kosher kitchens, people don't regularly cook mac and cheese on one burner at the same time that they're making chicken soup on the burner next to it. But there's nothing that prohibits that, right? So pushing it with taking risks that are allowed, that you're allowed to take, that other people take, and finding that way. Now, if there's no way to violate OCD without also violating religion, that sounds to me like it's not really OCD. There's nothing excessive. You're just struggling with feeling oppressed by the religious rules, maybe. That's okay too. People can experience that, but that's not scrupulosity. So there's always a way, if you're clever and creative, to pull those apart and find a way to do something that religiously is still okay, but OCD rule-wise is not okay, and that's what we want.
I think I love what you're saying, and I think it really reinforces the message I try to always put out, which is I think sometimes we push the exposure piece, not that it too much, I wouldn't go as far as saying too much, but we forget to focus on the response prevention, which I think is what you're saying, which is you're focusing on reducing compulsive behaviors around that obsession instead of focusing on like, how can we face your fear in an exposure setting? Is that what you're saying?
Well, partially, although we do also focus on the exposure side, it takes creativity sometimes to figure out how to push it within the bounds of the rules. Now, there are some religions, certainly this would also be the case with secular morals group, where there aren't as clear rules about these things. And so that presents its own kind of challenge. But a lot of the scrupulous folks I work with, they've talked to their priest, to their rabbi, to their pastor 1,000,000 times.
Yeah.
They know the answer. They're holding themselves to a standard because of the fear or the uncertainty that's greater than what their own priest does himself.
Right.
And so we can push it with the exposures without stepping over the line to doing something that's actually prohibited, proscribed.
Right. And now for one of the products that I created was ERP School, which is an online course for ERP. And we talk a lot about the use of Imaginals for situations where, like you said, I'm not going to tell a client to go and have sex with someone of the opposite sex if they have homosexual OCD, or I'm not going to tell them to, like you're saying. So is scripts and Imaginals something that you personally practice a lot with clients?
Yeah, all the time. That's a great one also for Scroop. I've got a list of a few more things, but didn't want to ramble on quite too much. But yeah, absolutely. Imaginals are really well suited for that sort of thing. And the reason is because at least one good use of Imaginals is, so if in vivo exposure allows you to face a situation, an object, a physical trigger, imaginal exposure allows you to face a thought. That's why it's used so much with PTSD. PTSD and OCD have some fundamental similarities because sort of the phobic stimuli, if you will, are very much mental. They're thoughts. They're not all the time, and there's some exceptions, but in the case of PTSD, it's usually a memory, a traumatic memory. And in the case of OCD, it might be other kinds of obsessions. And so when you face an object, a snake, you get more comfortable and less anxious with a snake. When you face a thought or an image of a feared outcome, you get more comfortable with that thought or image of that feared outcome. And especially then with scrupulosity, when a lot of people have obsessions that are less easy to confront. Like, how do you find out about whether you're going to hell? How do you find out whether you're in God's good graces, whether you love God enough? How do you find out whether you've committed the unpardonable sin? There's just so many things like that that are hard to face in a direct way. Now, I just want to say that I don't want to overstate how different that is from the rest of OCD. You can have people with OCD contamination concerns who are afraid that if they use this product in 25 years, they're going to get cancer. And of course, we can't wait 25 years to find that out either. So obviously, OCD treatment doesn't require people to know whether the bad thing happened. In fact, so maybe this time it didn't happen. How do I know next time it won't? So that's not really what needs to happen anyway. But especially with Scroop, when there's so much that's just really uncertain and future, and you may never know, or if you'll know, it won't be till maybe the next life or something. Imaginals are really a great tool.
Right. Yeah. Is there any other things that you had to talk about regarding the treatment?
Well, I'll throw it real quick without going into too much detail. First of all, prayer is a big one. And this may differ somewhat religion to religion, but prayer gets tricky because patients often believe that prayer can work, whatever exactly work would mean for them. And so how do you handle that? Like praying for bad outcomes with somebody who believes that prayer can actually affect something, is that really appropriate? And so there are a lot of special considerations with prayer. Another one is working with clergy. I'd say certainly not always, but I often find it really helpful to involve clergy in treatment. And usually I find them to be really helpful as long as you sort of involve them right.
Yeah.
And then the last thing to maybe throw into the mix is just, and this is a little more of the cognitive work, I think it's useful to talk with people and help them think through for themselves how they make moral judgments, like what their decision-making processes are. So things like, well, how do you decide when a thought is evil or not, or is sinful or not? And I'm not the final arbiter of that. How do I know, right? That nobody knows exactly. People have different ways of thinking these things through. But you can help people try to articulate what their criteria are. And they often see a lot of inconsistencies, and then they get a chance to think through. Some of the kinds of inconsistencies might be how I judge myself versus what I think about other people. So you might have somebody who's okay, even with their priest doing that, but me, no.
Right.
So why? What's the difference? And then, of course, in the OCD world, we're so well aware, back to the thoughts can be sinful thing, like thoughts are just thoughts we always talk about, like neural noise is something I often say. And yet there are people who think about it quite differently for non-OCD reasons. So then how does that work? There's so many, for example, Catholics in the world and in the history of the world who have not suffered from this.
Mm.
And so what are they doing? Because they're people too. So they're having intrusive thoughts sometimes. How are they making these decisions? And so what is it about a thought that might make it sinful? Does it matter if it's a fantasy versus it's intrusive, if it's intentional versus accidental, if it leads to distress versus leads to pleasure, like if it's for the purpose of, in the long run, having this thought less in treatment? So helping people work on how they go, their own criteria for how they go about making decisions, I think, can be helpful sometimes.
Right. So great. I mean, I think that really helps people who are having so many different areas of this come up for them, right? Where it's just so confusing. Sometimes I've had clients, or actually I have clients now who they get hit on both sides, that if they do something as a compulsion, it helps them in one area, but then it causes another obsession on the other side because, I was doing a compulsion and that's not serving God. And now, so they're hit from so many areas that, stuck in between a bunch of obsessions.
Yeah, definitely a rock and a hard place right there.
Right. Okay. You have gone through this really beautifully. So thank you so much for how articulate you are. And I love how you really identified that specific way of doing the exposure piece, because I think I even have a little bit to learn there. So I'm so grateful for you. It's a great reminder for me as well. So, I'm going to totally always be open to my own learning here as well.
Thank you.
Really
Thanks.
wonderful. We have some listener questions. I did a poll on Instagram of questions that people may have. So I would love to get your thoughts on these. The first question was about including the clergy, and you really already answered that so well. Is there anything else you wanted to address regarding how we can include the clergy members?
There's some procedural things and maybe just a conceptual way to approach it. I found, really to my memory at least, in all but one case, I found clergy to really be helpful. And I don't want to be a religious authority with scrupulous patients. And actually, I downplay how much I know because I grew up going to Orthodox Jewish schools. So I actually know quite a bit about some of those rules. But you always worry in a case like that, that I can be seen as, like, if I suggest that we do something, or if I don't stop a patient from doing something, that somehow that sanctions it, or that can sort of serve as subtle reassurance. I don't want to be caught up in that. I don't want to be looked at as a religious authority. I'm not, but even to whatever extent I might know stuff. And I don't want to get involved in religious debates even, because that makes the issue about religion. So in some ways, it's actually really helpful for me to be able to involve clergy. So we have an expert in one thing, an expert in another, and of course the patient is the expert in their own experience. And we can figure out ways that we can effectively implement ERP that don't violate the religious proscriptions, for example. But there's some things that are important to do to set that up right. It's not a bad thing. It makes total sense. Clergy are not trained to think about religion in terms of, like, how far can we go to push the boundaries of this, right? Why would that be part of their training? It's more like, so if you went to a priest and they suggested you said Hail Marys or something, you went to a rabbi and they said, well, instead of doing it this way, why don't you try doing it that way? Sort of to avoid any potential problems. That's very reasonable from a non-OCD perspective. It sounds weird when we're trying to push the boundaries of going as far as we can without actually crossing the line, because that's a great exposure then. And so it takes a little bit of work up front. If there's a clergy member you collaborate with a bunch on these things, then obviously they'll get it. But at least at first, and I try to let the patient pick who the clergy member is who matters to them. I'm not going to cherry pick some very liberal, rabbi who's going to say what I want. I think it's disingenuous, and also I don't think it'll be so effective. So that might mean working with a clergy member who's not so familiar. And so you want to explain where you're coming from and convey respect. We're actually, this has been keeping your parishioner from being able to come to Mass for months now because of the thoughts. We're trying to help them get back to pursuing what they value. And one way that we do it is and sort of explaining where you're coming from and being very clear that you're not trying to undermine and that you want to collaborate. And then there's some guidelines you want to work out with the patient about how they're going to use the information. So obviously you don't want checking and rechecking to get the information. And so you want to formulate beforehand exactly how the question is going to be asked. Maybe it's a set of questions, so it's not asked in a way that might be problematic.
Right.
And set up guidelines for how it's going to be used. Like maybe you can write this down and you can refer back to it, but you can't re-ask because as we all know, like what ends up happening is then did I explain myself well enough? Or maybe the clergy person didn't understand me well enough, or I didn't write it quite right, or what about this variation of the situation? So you're going to do some setup work up front, and then I find it's usually quite helpful.
Right. Absolutely. And sometimes just teaching and educating the clergy member on what reassurance looks like, right? Because sometimes I've had cases where we've gone and we've spoken to the minister or the leader, and then everything's great. And then the next week, my client's like, but I don't know if the clergy member really understood this intricate piece. And so they want to go back. They want us all to go back and readdress. Are you sure it's good? You know what I mean? So I think that is perfect. Okay, next question.
Yeah.
Is it common to question whether you're a good person or just do a good thing to prove you're a good person?
So I actually think that to some extent, lots of people, with or without OCD, think about that at least a little bit. So when you say, is it common? I don't know if the reader had meant, is it common for scrupulous folks? But I think to some extent, people wonder about that. And of course, the key is accepting that there's an inherent uncertainty about that, right? You'll never know, and you'll mess up a lot if you're human. And every religion, by the way, has that built in. I mean, there's confession if you're Catholic.
Right.
which is a recognition that you're supposed to do certain things and you're not supposed to do other things, and you'll screw up because you're a human being. And so here's a mechanism to make things okay.
Right.
And at least as I know, the religions I know about, they all have some version of something like that. So you will mess up and you make a good faith effort to live the life that's important to you. John Grayson sometimes quips, I guess, that the difference between the scrupulous folks and people and other people, maybe between people not just with scrupulosity, but other types of OCD to some extent too, is that you're asking the questions that like philosophers and theologians and everybody's asked for just millennia, like the nature of evil. What are people capable of? How do I know if I'm good? What if I'm responsible for something just awful? Am I selfish? All those kind of questions. And the way John says it is, the difference is that the folks with scrupulosity actually want the answer.
Right.
So,
and want certainty on the answer.
Yeah. And there is no short answer. And so you can get really caught checking. So I assume that when you say, doing a good thing just to prove you're a good person, there's a lot of checking. It's really similar to what I said before in the secular moral case, somebody watching things and then wondering if they felt it enough. So then they watch something else and they're trying to monitor it. We see this with other kinds of obsessions too, right? It's people who have obsessions about their sexual orientation. I might be gay. So now they start watching straight porn to see if they're sufficiently turned on. But they're so anxious that maybe they're not. Or then they start watching gay porn to try to make sure that they're not turned on. But they're anxious, which is arousal too. And oh no, like what if I was a little? So all those kind of checking things, it's like you said, trying to be certain about it. You can't. There's no possible way to get certainty about that sort of thing. And it's just the stakes do feel really high.
Right. And what comes up for me when I read that is going back to your statement, which is that OCD is the problem. And our goal is to actually direct away from trying to solve it to just actually living your life, right? Whatever that life it looks like for that person. So I love that the way you frame that. Okay. How do you practice acceptance, even if it feels against your morals?
Yeah. So, well, in some ways, that's a question that could be slightly modified for any type of OCD, right? How do you accept risk when it feels dangerous or scary too, right? And here we're talking about morals, and so I'll try to answer about that, but I don't actually see that as fundamentally different from other sorts of treatment. So I guess my answer is that emotions, including anxiety and fear, are really important signals, right? Why are they adaptive? Why do we evolutionarily do we have them? Why did God create us with them? However you think about that, but we have these emotions and clearly they're good signals, right? If you had no anxiety at all, you'd be, I don't know, I tell my students who are undergrads, if you had no anxiety the night before the midterm, you'd be out doing shots or something instead of studying. That wouldn't be good. If you had no fear, you wouldn't get that adrenaline rush. If you were in danger, to jump out of the way. And
we'd be dead. We would cross the street in front of a truck, right?
That's right. Exactly. Right. So emotions are really important in terms of giving us, also conveying, but I'm focusing on the giving us information about things. But the problem is that it sets us up to be vulnerable to making a cognitive error that we call emotional reasoning, which is sort of inferring from the fact that you feel scared that there's danger. And again, I just got through telling you that that's the reason we have that emotion. I mean, how do I know if that's the reason? But at least it's the story that makes sense to me. So that's when it's working well. And now I'm saying it's a distortion. If you have a smoke detector in your kitchen, so you literally have it there because it's supposed to tell you that there might be fire if there's too much smoke. But everybody who has a smoke detector has at one point probably had one that was either broken or had a low battery, right? And it's going off every time you're frying eggs. And so you go to the kitchen, you fry eggs, and as soon as it starts to smoke a little, it starts beeping. And now you have a choice. Your whole life you've been taught, as soon as that goes off, drop what you're doing, don't try to even take anything, and carefully but immediately walk out. Yeah, but it's the eggs. How do you know? Maybe there's another fire somewhere else in the house at the exact same time. Like, you can't be sure. So you could either drop your eggs and leave the house, and then after a while it'll stop beeping and go back in. You can keep doing this. And the bottom line is you're going to be really late for work or you're going to have to eat cereal every day. Or you can say, look, I know that the calibration is off here. Yes, the job of this detector is to say danger, but I know this one is giving me false alarms. Can I be sure? No, I guess it's possible that at the same moment I started frying eggs, an electrical fire started in the attic or something. It doesn't seem likely. It seems unreasonable. And so you can decide to stay in the house. And there's two things that happen if you do that. One is that you'll actually get to get your eggs and get to work on time. So that's sort of pursuit of your values and goals, if you'll be generous with me. But the other thing is that it'll be really unpleasant because those things beep real loud. So you'll have to tolerate how unpleasant it is to get through it, and then you'll be able to do what you want. I think that in many ways, tolerating that feeling, the feeling that it's against your morals, which is different from what I was talking about before when I said helping people try to learn to think about how they make those judgments. So that's important for them to figure out their criteria for these judgments. But the feeling, the sense, the emotional part, that's emotional reasoning. And for somebody where their smoke detector is broken, they got to stop listening to it. And I'll finish with saying that my student actually has data showing that people with scrupulosity in particular endorse items on measures about believing that it's important to listen, to pay attention to your emotions and how you feel in making moral judgments. So I actually think that to some extent, I don't know, I don't want to overstate it. I don't know, it's a fundamental problem, but it's a really common problem for folks with this sort of, there's so much ambiguity and there's so much like it feels wrong, or when it feels wrong, you can infer that therefore it is wrong.
Right.
But that's a broken smoke detector telling you.
Right. And it's funny, as you say that, I have this image of me like swaying with the towel, like trying to air it out. like that's kind of that ERP act or mindfulness work. Like you're like, I know it's the eggs here. I'm just going to like wave the air around. Right. Okay. That's beautiful. I think that's so appropriate. The metaphor there is so helpful. Okay. How do you deal with the quagmires inherent in ERP and religion related to sinful thoughts?
Okay, so I'm not sure which quagmires the reader might have meant specifically. The sinful thoughts part makes me think that it's getting back to what we were talking about before, that, thoughts, at least in some religions, can have moral import. And just telling people just to think thoughts that they might believe are sinful, like maybe that's more like saying go eat a cheeseburger. And yet we have all these intrusive thoughts that sometimes could be kind of disturbing. So how do you help somebody who believes that thoughts can have moral import? How do you help them deal with intrusive thoughts about negative moral things? Is that an okay way to imagine this question?
Yeah.
Yeah. So I think that goes back to what we were talking about a little while ago. And these are questions I would really pose to the individual, because again, I have no great expertise, and nobody's revealed to me the cosmic truths about what thoughts matter and which ones don't. So just how do you think through? I would challenge somebody to think about, how do you decide what's a sinful thought and what's not, and also what you need to do about it. So I would say probably there are thoughts that for a standard Protestant Christian, I purposely thought this really awful thing and got a lot of enjoyment and fantasy out of it. That maybe is something that would be sinful or you're not supposed to do. But what happens when you're having those thoughts intrusively and they're actually making you distressed? Is that different? If not, then what might make it different? What about if you're doing it for the purpose of treatment, which really means, wink, wink, we're thinking about it more so we can think about it less, right? So is that different? And again, I'm sort of benchmarking against all the people, including clergy members, including great saints, all the people who didn't get stuck on this. Now, some did, by the way, and it's actually really fascinating to read. St. Ignatius Loyola writes about what we would call his scrupulosity now. It's really insightful. He anticipated a lot of things that now are part of ERP and standard approaches. But of course, most people who are religious don't get stuck on these things. So why is it that your priest, for example, why is it that your priest is not judging it the same way that you are? Why is that? How have you thought about, have you asked maybe even your priest how they handle when they have intrusive thoughts? Like, what's the procedure for that? What's the way of judging it? So it's hard to give a very specific answer when you say, how do you deal with, like, intervention wise? I would say the starting point, though, is asking the person to think through those kinds of issues and clarifying their beliefs about sinful thoughts, beliefs, not fears, not wonders, not uncertainties, but figure out what you believe and what you value. And then we could see where it's matching and not matching. And then we have something to work with.
Right. So good. So good. Some of these actually are going to go under it. So I think the truth is, one of the questions was, why is there such a strong feeling of guilt attached? But I think you sort of addressed that related to emotional reasoning. Do you have anything you want to specifically add with that one?
No, guilt, shame, these moral emotions are so not surprisingly related to these moral fears. But there's just so much inherent uncertainty. It's like we were talking about before, like, what's enough? What did I truly think, feel? Could I have done more? How do I know what my intentions really are? And you combine that with these super high stakes that you brought up also, the eternity. God, like, gave you life. This isn't even just about some, small thing like a horrible disease, right? But like eternity kind of things combined with so much uncertainty, it's fertile ground for those. And so that's why helping people clarify how they go about making moral judgments might help them with this, because certainly guilt is going to happen people, right? Like the Jews love to joke about guilt tripping Jewish mothers, but the Catholics love to joke about how much guilt there is. Like a lot of religions have this joke that they're the ones who are so guilty, because guilt is an emotion that comes along with us.
Right. It's interesting. I love that you frame it that way, because it is true. It's like a common theme amongst most religion, right? Is sort of that, with not even stepping into the OCD realm, but just in general.
Yeah.
Right?
And it's another example of something where guilt is not bad. I mean, there's no emotion that's bad if it's dosed appropriately. So guilt is something that I imagine will motivate you, if you feel it the right amount in appropriate context, to try to do better, to try to not make that mistake again, to try to improve yourself, whatever, those kinds of things. Maybe it could be a display to other people also to repair things when you look or say that you feel guilty about something, and it can smooth things over with somebody that you may have wronged or something like that. It's not bad to have guilt. It's very functional to have guilt. It's bad when you have such excessive guilt that it paralyzes you and it keeps you from doing normal things. It keeps you from repairing things because you're feeling so down, those kinds of things.
Exactly. Oh, I love this so much. I think that is just such a great way for us to end, because I think at the end of the day, it's a lot about tolerating those uncomfortable emotions, right? So I'm so grateful for your time and your amazing expertise in this area. Thank you so much.
Oh, thank you. It was a real pleasure to get to talk to you.
Right. Okay. Thank you again. And Jed, how can people get in touch with you or find your resources? Share with me where we can get them from.
Yeah, so you could probably just Google me and find me either through Swarthmore, where sort of my day job is that I'm on faculty there. I have a personal website also, and people can contact me through that. So lots of ways to find my various emails, and very happy for anybody to reach out about this.
Oh, thank you. So exciting. So all of the links will be in the show notes. And thank you again.
Thanks.
Please note that this podcast or any other resources from cbtschool.com should not replace professional mental health care. If you feel you would benefit, please reach out to a provider in your area. Have a wonderful day, and thank you for supporting cbtschool.com.